I'm here with Mr. Z. Brickles. He's the Director for Health for the Garden Route and Central Karoo. Mr. Brickles, how do you feel about today, the vaccinations that have started?
So really excited. I must admit I was up quite early this morning, but I think it's more excitedness than anxiety. I think initially we were all a bit anxious about the arrival of the vaccines, how is the uptake going to be, but I think over the past few days we've seen that people have been really keen on taking the vaccine. And remember that the first phase of this vaccine rollout is a completely voluntary process, which we're starting today. So our staff that we're vaccinating all had to volunteer to be part of this process, and obviously had to sign consent and register on the electronic vaccination system in order for them to be in line to receive the vaccines. Over the next 2 weeks, we plan to vaccinate about 380 people. Well, at least 320 this week and then 360 the following week, so 680 people in total within the first cycle. And then depending on the amount of vaccines we'll be receiving in subsequent tranches, we'll then start rolling out to more of our staff. The plan for phase one, obviously, to protect the health system and to strengthen the health system. And in order for us to achieve that, we need to make sure that our healthcare workers and our health force are strong and protected against the COVID pandemic.
And which healthcare workers are prioritized? Which ones are prioritized?
So what we've done in terms of prioritization, we're obviously looking at certain members of the healthcare staff. Obviously those ones are most at risk, and there we've applied certain criteria looking at the age of the person. We also look at the exact location where they are working, their risk of contracting the COVID virus, and then obviously looking at, and one of the important considerations were people who are keen on receiving the vaccine. So that was one of the criteria. You have to be willing to take the vaccine.
Okay, thank you.